Today we are gonna do something really simple. But I use Dysport instead of Botox at the clinic here. I like it better. It's all anecdotal. There's really no science comparing the Botox and Dysport. I like it better based on my experience. It starts faster and it lasts a little bit longer. Most patients like it. I know Dysport itself is, I'm sorry, Botox itself is a big name. It has better name recognition, but like I said, I like Dysport. They both work the same thing, the same way. They're neurotoxin. So I wanted to get you closer here to show a little bit of what we're talking about. So this is the facial anatomy, and this is where the frown line is, and this is the procerus muscle, the orbicularis, which is very important, and I'll talk about that in a second, and the frontalis muscle. This is where the forehead is, and this is where the crow's feet are at the corner of the eye. So the orbicularis muscle is very important because if you inject right into it, which is right above the eyebrow, then you may have an eye drop or a droop or heaviness in the eyelids. With that said, we are going to start with the frown line, and then we go to the frontalis muscle, then we inject in the crow's feet. So those are the three areas that are mostly done for Botox and Dysport. Okay, so the first, so put your head back a little bit if you don't mind. Can you look at me and then frown? Do a little frown. So again, this is you can see the muscles. And a lot of people really don't realize that this is a neurotoxin. What it does, it actually relaxes the muscle. It doesn't make the wrinkles go away by injecting the wrinkles. What it does, it relaxes the muscle. By relaxing the muscle, then you get the wrinkles to go away. So it's really 3 injections right in the frown line. We do the first one. It's very simple. Then the second one, the corner of the eye. There you go. How you doing? Okay, go ahead and raise your eyebrows for me. So now this is the frontalis. If you can move your hair back like this. Yeah, just a touch. I'm gonna hold this down a little bit for me. Yeah, just a quick second. Let me get another one. And some people have a little bit of oozing from the injection site if they've been on, aspirin or blood thinner, or if we're next to a vessel. That's usually not a big deal. So raise your eyebrows and keep them raised. So now we're injecting, and this is where the orbicularis is, and we need to stay away from it, so we inject a little higher. With this port in particular, it travels more than the Botox. That's why we stay pretty high, so it doesn't cause any drooping. And then we'll go a little closer to the hairline to inject. It's very fast, and those are really tiny. This is a very tiny, tiny needle. So now we go to the crow's feet. I'll take this from you. I got it. Perfect. See, even she has oozing a little bit, but there is no bruising at all. So when we do the crow's feet, go ahead and smile for me. You'll see the crow's feet. There is a little vein, the orbital vein. Try to stay away from it. So I inject underneath it, right into the corner of the eye. Then there is a little trick that I do, inject right at the corner of the eyebrow. That causes a little bit of elevation. Raise your eyebrow for me for a second. And then, because I know this patient, I know Vesna, I know in the past she needed a little bit extra on this side, so I'm just gonna do a touch extra. So go to the other side if you don't mind. I'll go this way. Smile again. So, and then not everybody is the same. Some sides are more wrinkles than others. So this one, the crow's feet on this side, is a little bit more. Okay, raise your eyebrows on me. Frown. So we have a little bit extra. I'm just gonna put in the frontalis muscle. And then those bumps that you see that they form in the forehead, those from the injection, It's because of the volume that we have. They go away within 30 minutes. Though you don't see them. How was it? Not bad. All right, and that's it. We're done. Thank you.